Hi, Lee Phillips again. You got to remember to subscribe to the YouTube channel so we can keep giving you updates, and you need to contribute things that you learn when you're taking care of an ALS patient or even a paralyzed patient. I want to talk about immunoglobulin for a minute. They call it IVIG. It's given intravenously, and until just recently, Christy, just before she died, we applied to have the Medicare pay for home intravenous of this. Christy and I were insured with Medicare. Once you become an ALS patient, you're automatically disabled. I mean, there's a little box up at the top. We've talked about that in another YouTube, but you're disabled, you're on Medicare, doesn't matter how old you are, and we got them to pay for, at the end, we applied to have them pay for the IVIG. Medicare's policy right now is that you can only get an IV infusion in a clinic. They won't pay for it in the home, which is absolutely stupid. We couldn't take Christy to the clinic because the clinic is a petri dish of every cold and flu and everything else, and Christy couldn't get sick. A cold is fatal when you have advanced ALS. So we gave her early on, she had always had bladder infections, and the infection, when she got the infection, it would exacerbate, it would speed up the ALS progression. It just drove the ALS nuts. So the neurologist said, now, ALS has nothing to do with autoimmune or anything else, but I have found that if I can qualify my patients for immunoglobulin infusions, and Christy got 300 to 400 milliliters every 2 weeks, he said, the people I've gotten on immunoglobulin have done substantially better. I don't know why. It is not at all an autoimmune disease. It's just because they don't get infection. The one other lady that we knew, she got ALS after Christy, and she died years ago. Christy survived 5.5 years, which is pretty good. And there was no reason for her to go. She just left town. She didn't choke, she didn't suffocate, I didn't have to pull feeding tubes, I didn't have to do any of that sort, or feeding tubes, ventilator tubes, none of that stuff. I didn't have to withhold medication when she got a cold and was getting pneumonia. She just went to sleep and was gone within 2 or 3 minutes of my turning her over early in the morning. But at any rate, we gave her the immunoglobulin. It kept her from getting colds. The other lady that we knew that had ALS, she got 2 or 3 colds, and she spent a week with each cold in intensive care at the hospital. I would think that it would be worth their while just to keep the ALS patient healthy by giving them the immunoglobulin. The immunoglobulin's expensive. I don't know what this runs. The list price, which is a bunch of BS, is like $15,000 per bottle. That's $15,000. So it is expensive. If you can get qualified for it, then it may help. And our neurologist said I've had good success with it. The people that have had ALS that I have treated, that I have been able to qualify for immunoglobulin, have done better. So just a thought.